There are 9 ways to control your diastolic blood pressure. Out of them, 6 are the ways that you can do on your own, and 3 ways are that will be exercised by your physician after consultation with you and taking your opinion. Number 1, the things that you can do is control your diet. And in diet, you have to take more of vegetables, you have to take more of fruits, and even in the dry fruits, you can take it, but it should not be roasted, it should not be processed, it should not be roasted with salt. If you do that, the roasted and the salty dry fruits is going to play a havoc with your blood pressure. Don't do that, please. The second thing is control your salt intake. Less than 2 grams of salt should be used in 24 hours. And usually we are taking up to 4 and all the way up to 10 or even more of salt per day. And the reason for that is processed food. Every processed food is almost having some degree of salt in it, and we are also using some additive salt just to add taste to it. But it's a poison that is within our reach. Don't do that. Third thing is exercise. Exercise is something that is of crucial importance in controlling the diastolic blood pressure, and I have talked about all the different types of exercises that will control your blood pressure, but I'll just try to go through them in a very brief manner. Brisk walk is an excellent way to control your blood pressure. You need to do that up to 30 minutes a day and 150 minutes per week. Along with that, cycling, same is the value, 150 minutes per week. And the dancing, if you are the kind of person that likes to dance, it's a perfect exercise. 150 minutes per week is a wonderful way to control your blood pressure. And they control the blood pressure from 7 to 6 degrees, and each of them individually will reduce the blood pressure to 6 degrees each. So combinedly, they can reduce the blood pressure to up to 18 millimeters of mercury. The next exercise is swimming. It's a wonderful exercise, and you can do that if you have the availability of an indoor pool, if the weather isn't allowing an outside pool around the year. Going to the gym, for the aerobic exercise is also a wonderful way to control your blood pressure. The unique thing about the next exercise is you can do it within 10 minutes in 24 hours. And if you do it persistently, it can reduce your diastolic blood pressure by almost 7 millimeters of mercury. And these are the jumping exercises. You can do the rope jumping or any kind of exercise, and that will lead to a reduction of diastolic blood pressure by almost 7 millimeters of mercury, or if not more. Yoga is also a wonderful exercise, and that can help to control the blood pressure too. The next thing is stress management. Stress management is of central importance in the control of diastolic hypertension. As I previously mentioned, the diastolic hypertension is usually the disease of the middle age, from 30 to 50 years of age. These are the persons who are at their pinnacle of their career. They are working hard, their working age time, they want to achieve something, they have set timers. By that time they have to come up with a certain number, and that creates a lot of stress. In that case, if you are not able to curtail that, if you are not having mindfulness as a part of your life, this is going to be a very jumpy road down the lane. You need to do mindfulness, you need to do meditation, and there are so many ways to do that. And I have previously mentioned a Healthy Minds program that is freely available within your reach. You can download it for free. The next thing is the sleep. The sleep is a wonderful way to control your blood pressure. If you sleep for a good amount of time, 6 minutes or more, that will help to control your blood pressure. If you're having snoring in your sleep, you need to check that. Talk to your physician, get your sleep studies done. If you're having an obstructive sleep apnea, this is a condition in which there is a lack of oxygen within your body when you sleep. and this will lead to a rise in blood pressure. If you control that, you're going to get fixed in terms of diastolic hypertension. The next thing is obvious. If you are having some other diseases like diabetes mellitus, which also leads to diastolic hypertension, you need to control that. You need to control that in a manner with medicine, with a lifestyle. Don't take the food that will just exaggerate your diabetes and make it uncontrolled. If you do that, that is ultimately going to lead to worsening of your diastolic hypertension. Now, these are the 6 things. The next 3 things are related to your physician. The classes of the drugs are ACE inhibitor, the ARBs, valsartan, losartan and all that. The calcium channel blockers and the beta blockers are the second category that are used for it. The third category is the diuretic. Diuretic is a drug that removes the sodium from the body. The thing is, usually you have to use diuretic in a patient of diastolic hypertension, but never ever use a drug without prescription or the consultation of your doctor. I am not advocating any kind of use of medicine on your own. If you are having some trouble, talk to your physician and tell him about those 6 things that I want to practice, and he will let you know what suits you the best. Every person is different. He has different priorities, lifestyles, body habitus, and it does not mean that one thing can fit everybody. So you can choose from the first 6 things, but out of those 6 things, you need to talk to your physician that which one will be the best for you. I hope this video brings some value to your life. Thank you so much for tuning in.